Here's the way when I teach classes to students, here's the way I characterize the public health system in Arizona. Whereas your county health departments are your public health retailers. So those are the folks that have the TB control programs. They're the folks that inspect the restaurants. They're the folks that actually run the WIC clinics, women, infant, and children clinics. They're the one that run the vaccination programs. They're the ones that do the epidemiology. That's the boots on the ground workforce for public health in Arizona. The state's role, the Arizona Department of Health Services role, I always viewed it when I was in my job as we're the public health wholesaler. Our job is to draw down as many resources as we can from the federal government so that we can pass that through to our retailers so they can move their public health product through those safety net programs and other public health programs. And at the same time, we're the interface with the state legislature where we can try to help inform them before and during legislative session about the pluses and minuses of the various bills when it comes to public health outcomes. The state health department's job is we apply for grants, whether it's HRSA, CDC, WIC, what have you, and then build deliverables that make sense for the county health departments to invest in the kinds of programs at the local level that make improvements. Now, with the CARES Act money that came through Congress, I view that not as public health infrastructure spending, but rather emergency response spending that would provide governors with an opportunity to build a safety net so that they could implement public health interventions to help slow the spread of this virus. And many governors looked at it that way, where they saw the money as an opportunity to say, for example, improve unemployment insurance benefits, because if you needed to shut bars, restaurants, and nightclubs for a period of time, you had some sympathy for the workers within those programs and the business owners. And so the CARES Act money, in my view, should have been used to build safety net programs to help allow you to responsibly implement interventions at the community level to help slow the spread of the virus, recognizing that some of those interventions have real life impacts on the ability for people to make a living. Our governor never really looked at it that way, in my view. Some of the money he did use for infrastructure, for that kind of spending around housing and so forth. And he did use some of that CARES Act money for that purpose, but he also took $400 million of CARES Act money and backfilled state agency general fund budgets to essentially, and I'll just call it what I think it is, which is laundering money back into state agencies for expenses that those agencies have already incurred and would have incurred normally on any other year, and backfilled that and essentially used that money as opposed to using it to, for example, boost unemployment insurance benefits in December, January, and February, when he responsibly, I should say they, talking about Dr. Christ as well, they could have implemented a safety net so that there would have been enhanced unemployment insurance at bars, restaurants, and nightclubs so that the servers would be able to make a living during another pause. But sadly, they elected to prioritize the commerce within bars, restaurants, and nightclubs over the lives of ordinary Arizonans. And as we know now, we have the highest per capita death rate in the entire country. And it's a direct result of the policy decisions that have been made by Governor Ducey and Director Christ. We had an opportunity to save many, many lives in Arizona by suspending the operation of bars, restaurants, and nightclubs. The governor elected not to do that. That was the big opportunity to save lives in terms of interventions during the pandemic. We're now in a phase where the cases, even the death rate, and the trajectory of the epidemic is improving greatly. And of course, we're all focused on vaccination. My primary cause at this point is to try to encourage the governor, Director Christ, to implement policies that are more equitable so that lower income communities have an opportunity to get vaccinated at the same rates that high income persons have been able to. And so far they've been unable or unwilling to implement those kinds of changes. They have done superficial things and created some, photo opportunities that make it appear as though they are working on that issue, but in fact they are not. I think we will probably in the end just have to suffer through this, and lower income people will be getting the short end of the stick. But to answer your question, we will be approaching herd immunity in, I would say, the middle of the summer. And at that point, we enter a new phase of the pandemic, which I'll call recovery. And that's a matter of looking at those sectors of the economy and those persons who were adversely affected during the pandemic and in a disproportionate way, and making sure that the financial investments that come with that additional federal money is used to really help the very people that suffered the most during the pandemic. I will use an editorial comment now and just say that I have zero confidence that the governor nor Director Christ will prioritize those communities that have been suffered such during this pandemic. What I expect them to do is to do what they have done for the last year, which is to reinforce the financial position of their friends and contributors. And I don't have an answer for that except to say we were just very unfortunate to have this team in office during the biggest public health crisis in the last 50 years, because of the decisions that they have made cost many lives and caused a whole bunch of unnecessary suffering. Well, I think at this point, we are now emerged from the huge surge in December, January, and February, when quite honestly, contact tracing, let me start with that. Contact tracing was of limited value just because there was so much community spread. We're now finally at a phase where the case counts are in the, let's say, 1,000, 1,500 per day, and therefore we have enough. The case count is low enough so that case investigations and contact tracing can make a measurable difference in terms of the slowing of the spread of this virus. Testing will always remain a part of a responsible response to this pandemic. But as more and more people get vaccinated, I expect to see less and less demand for that kind of testing. And I would expect to see testing to transition more towards urgent care type of sites, primary care offices, et cetera, just because the more people that we have vaccinated, the less likely we will continue to see cases in the community. And so we are, I think, entering a good phase of this after we've been through hell in the last 3 months, in which, I expect to see the cases continue to decline. I expect to see immunizations continue to increase. I expect the disparities to continue because the governor, Director Christ, have no interest in the kind of equity that's important with vaccine distribution. But so there are problems with the situation that we have right now. But at least the worst is definitely behind us, and hopefully we have learned a lot as a community about the importance of vetting our elected officials and their appointees, because you never know when you're going to really have when you're going to need someone with compassion in these offices who is also talented and has a keen understanding of what it means to be a governor and a health director. But thank God that we've got a voter initiative within our Constitution, because this would be a very different state without it. We've done it over and over again. And it's not always the same group. It's different people doing this. It wasn't the Prop 206 people that raised the minimum wage was one group of folks. The people who did the Smoke Free Arizona Act was a different group. The moving Medicaid up to 100% of federal poverty, that was a completely different group of stakeholders. It's not always the same group that does it. To get involved in your precinct, to get involved in your legislative district, to go to your district meetings, to help foster good candidates within your district, because I don't see this as a this year thing. In order to make real fundamental change with how Arizona functions as a state, we've got to change the makeup in the state legislature. And that means getting involved in your precinct, getting involved in your legislative district, running as a candidate if you think you're a good candidate, knocking on doors, registering voters, talking to them about what's important, talking to them about the importance of the state budget. If you spend your time on like the now, you're missing the opportunity to lay the groundwork. It's about the planning for the future that matters the most, not like what you're doing today about this year's budget, but rather what are you doing today to prepare for a state legislature in 2024 that will care about the things that you care about, that will elect a governor that cares about the things that you care about. And that means getting involved in your precinct, become a precinct committee person, go to those LD fill in the blank meetings, work your neighborhood. It's not glamorous, but it's what really matters.